Good morning, guys. I hope everyone is well. Today I am going to do a video that's a little bit different than my usual ones. So I am a speech and language pathologist, and I've done a lot of videos on pediatric speech and language pathology, but I also work with adults and have a lot of experience with stroke and brain injury. Today I wanted to talk a little bit about aphasia and some tips for caregivers or loved ones or anyone that comes into contact with someone with aphasia and might benefit from some tips on how to communicate with them. So I hope this is helpful. I'm going to show you some slides and talk through them. All right. So just briefly, aphasia can be caused by stroke, sometimes brain injury, commonly. The language centers, Broca's area, Wernicke's area, but basically the language areas or centers in our brain are typically on the left side. It's not 100% guaranteed, but it's very common on the left side. So a lot of people who have a stroke or brain injury on the left side of the brain in those areas may suffer from aphasia. Aphasia is it's a communication disorder, and it could be receptive or expressive or mixed. So basically the individual may have difficulty understanding language after a stroke, may have difficulty producing language or speech. So there's dysarthria and expressive language, or they may have mixed. So they may have some difficulty understanding and speaking. So I'm not going to go into much detail for this video. I just wanted to give a brief overview and then now show you some tips on how to communicate with our loved ones or individuals who have had a stroke or brain injury or any neurological changes that have caused aphasia. Okay, so here we go. Just a couple tips or a few tips on how to speak to someone with aphasia. So now the first one I have is speak slowly and clearly. We want to speak slowly and clearly just in case they do have some receptive aphasia, so difficulty understanding language after stroke or brain injury, and speaking slowly and clearly allows them to process basically what you're saying to have more of a chance to understand. The next one goes with that. Keep it simple, short, simple phrases. Don't start talking in multiple phrases or multiple sentences. Don't, even in one sentence, try not to add a lot of complex language. Just keep it simple and short. The next one, give the person time to respond. So as you're talking to them, they may need, because of the injury to the brain and the possible receptive aphasia or difficulties understanding language that they were able to understand prior to their stroke or the incident, they may need extra processing time to listen and understand what you're saying. And then the next one is use visuals if you can. Use gestures, use pictures. So in therapy, a lot of times we might use visual pictures, anything to help complement or add to the verbal language. This could be very helpful for the person to understand what you're saying. The next one, I changed the color because this is really important. Don't finish their sentences. So if a patient or person has aphasia, it might take them a little extra time to find the words that they're trying to use to talk, to communicate. So if they start saying a sentence like, "Oh, I need my," and then they pause, and you know that they need their shoes or something, don't fill the sentence in and say, "Your shoes." Give them time to think about and process and basically retrain their brain to find the word, locate the word, and get it out. So give them time, even if it takes time, give them time to finish their sentence with the word shoes. I need my shoes. I need my shoes. Be patient. That goes with that. The next one is ask yes and no questions. So sometimes asking yes and no questions, especially if someone has a difficulty, they can the patient has maybe better receptive language skills, and their aphasia is more expressive aphasia, so their ability to get the words out and to talk. Sometimes, especially in the beginning, it's better to ask yes and no questions because they understand what you're saying, but they have difficulty producing a sentence, so, or word or phrase. So if you ask yes or no questions, they have the ability to maybe nod their head up and down or side to side, or even if yes and no is easy for them to say, then they can do that and you guys can decrease frustration and get through your discussion. Let them know that you understand when you understand what they're saying, and validate any communication attempts. This is very important. And then the last one is maintain eye contact. So next I'm going to go over what to avoid. So again, that was brief, but I don't know, hopefully helpful. Let me know, guys, in the comments, questions, if you if this was helpful at all, if you want me to do anything in more detail, and any other videos that you may be interested in relating to stroke, or brain injury, or aphasia, or anything else that you would like me to discuss. All right, take care, guys. Thank you for listening.